let's talk about something that might honestly shock you. We're going to explore a hidden connection between two of the biggest health concerns for seniors, gum disease and Alzheimer's.
So let me just ask you this straight up. We all think of a toothbrush as something for, keeping your teeth clean, right? But what if I told you it might just be one of the single most powerful tools you have for protecting your brain? Well, here's the answer, and it is a jaw-dropper. This is backed by some pretty incredible science. Researchers have physically found the exact specific bacteria that cause gum disease inside the brains of people who died from Alzheimer's. Just let that sink in. The problem that starts in our mouths is literally ending up inside our brains. And look, this isn't some rare or fringe issue we're talking about. According to the CDC, a staggering 70%, that's 7 out of 10 adults over 65, have gum disease. So many of us just write it off, a little bleeding when you brush, no big deal. But we're completely unaware that our mouths might be silently fueling damage somewhere much more important. But here is the number that really just stopped me in my tracks. Having chronic gum disease can increase your risk of developing dementia by up to 95%. That's right, it practically doubles your risk. It's a huge factor, even if you're doing everything else right for your health. So let's be super clear here. We are not just talking about a little gingivitis or having bad breath. Periodontitis is a serious chronic infection, and as you can see, it's considered a body-wide inflammatory disease. It creates this constant fire of inflammation that absolutely does not just stay in your mouth. Okay, so the big question is how? How in the world does something from your gums get all the way into your brain, which is supposed to be this super protected fortress? Well, scientists have figured out there are basically 3 secret pathways.
The first way is, it's basically a direct invasion. It sounds like something from a movie. Nasty little bacteria, especially one called P. gingivalis, can literally escape from your infected gums and get into your bloodstream every time you eat or brush your teeth. From there, they're like tiny intruders that travel through your body, manage to break past the brain's main security system, the blood-brain barrier. And once they're inside, they can actually start promoting the formation of those amyloid plaques we always hear about with Alzheimer's. The second pathway is all about inflammation. Think of it like this. Gum disease is a slow, chronic fire that's always burning in your mouth. This fire is constantly releasing these little inflammatory particles called cytokines into your blood. They travel everywhere, and when they get to your brain, they cause what's called neuroinflammation, which just damages brain cells and can speed up cognitive decline over the years. And the third pathway is this fascinating chain reaction. Here's how it works. You swallow the bad bacteria from your mouth, they travel down and mess with the good bacteria in your gut. And as we're learning more and more, an unhappy gut sends signals that can create inflammation and problems directly in the brain. It's a domino effect that starts right in your mouth. But wait, it's not just your brain that's at risk here. This whole story is much bigger than that. Your mouth is connected to your entire body, especially, as we're about to see, your heart. The connection between gum disease and heart disease is rock solid. Scientists have known about it for years. Those same bacteria that sneak into the bloodstream can also help build up the plaque that clogs your arteries. And that, of course, directly raises your risk for a heart attack or a stroke.
Taking care of your gums really is double-duty protection for your brain and your heart. And check this out. It's not even just about the infection itself. The simple act of losing teeth, which often happens because of gum disease, is its own risk factor for dementia. But, and this is really important, there's a hopeful side to this. Studies suggest that if you replace those missing teeth with dentures, it might actually help slow that decline. So you might be wondering, why are we focusing so much on older adults? Well, it turns out that as we age, a bunch of different factors can come together to create kind of a perfect storm for this exact problem. So here are some of the key reasons. Our immune systems just don't fight off infection as well as they used to. A lot of common medications for things like blood pressure can cause dry mouth, which is a big problem because saliva is what naturally cleans your mouth. Arthritis can make it physically hard to just hold a toothbrush properly. And let's be honest, dental care can be expensive, so many seniors skip it. On top of all that is this old idea that losing your teeth is just a normal part of getting older. It is not. Okay, I know that was a lot of pretty heavy information, but here comes the good news, the really good news. This is something you can absolutely do something about, and it is never, ever too late to start. So let's walk through a simple plan to protect your brain by protecting your mouth. It all starts with the basics, the things you can control every single day. Brushing twice a day, flossing every single day. And this is so important. If you see blood when you brush, please don't ignore it. Think of that as a fire alarm going off in your body. It's a sign of inflammation. And if you do have dry mouth, talk to your doctor because there are things you can do. All right, part 2 is about zooming out to the bigger picture. Things like quitting smoking and eating a diet that fights inflammation are huge. And so is this last point. You need to be the bridge between your doctor and your dentist. Let your primary doctor know about the health of your gums and tell your dentist if you've had any memory issues. They need to be on the same team. So if there's one thing I really want you to walk away with, it's this total shift in thinking. Taking care of your teeth and gums is not about vanity. It's not just about having a pretty smile. This is deep, fundamental health. This is proactive brain protection. Which brings us right back to where we started. A simple toothbrush, a string of dental floss, they might just be two of the most powerful and affordable tools you have to defend your brain and protect your future. It's kind of incredible, right? So I'll leave you with this one last thought. Your mouth really is a window into the health of your entire body. So take a quiet moment and just think about it. What is yours telling you? Because listening to that message could be one of the most important things you ever do for your health.